ulu akubungwe la World Vision Malawi omwe nawonso athandizire pogwira ntchito yolimbana ndi matenda amenewa. Ndipo pa ndalama zimenezi, ndalama zokwana 409,267,229 US dollars ndi za matenda a TB ndi HIV AIDS, komanso 84,442,883 US dollars ndi zothandizira ku matenda a malungo. Ndipo boma ndi lomwe ligwiritse ntchito ndalama zimenezi kudzera ku unduna wa zaumoyo, pamene ndalama zokwana 21,436,233 ndi ndalama US dollars. Zimenezi ndi ndalama zomwe zithandize ku matenda a chifuwa chachikulu cha TB ndi matenda a HIV AIDS, zomwe bungwe la World Vision Malawi ligwiritse ntchito. Zonsezi pofuna kulimbana komanso kuthana ndi matenda amenewa amene amasautsa kwambiri pakati pathu. Ndipo boma kudzera ku unduna wa zaumoyo komanso mabungwe osiyanasiyana ngati la World Vision akugwira ntchito zosiyanasiyana madera onse mdziko muno, madera akumudzi ngakhalenso madera a mtawuni, pofuna kuthana ndi matenda amenewa. Ndipo mtsogoleri wa dziko lino akhale akufika muno mu banquet hall ya kuno ku Kamuzu Palace nthawi ina iliyonse mmene muchitikire mwambo umenewu. Ndipo akamafika timva lipenga la ulemu, ndipo akafika pamalo pamene pakhalenso nyimbo ya mtundu wathu. Ndipo mwambo umenewu uyamba ndi pemphero, ndipo likatha pemphero pakhale malonje kuchokera kwa amene akuongolera zochitika pa mwambo umenewu. Ndipo akatha malonje amenewo pakhale anthu angapo amene ayankhulepo, monga woyimira kazembe wa dziko la America kuno ku Malawi, komanso woyimira kazembe wa dziko la Japan kuno ku Malawi, kazembe wa dziko la Britain kuno ku Malawi nawonso ayayankhula, komanso kazembe wa dziko la Norway. Nthawi ino timve lipenga la ulemu.
May we keep standing for our national anthem.
nyimbo ya mtundu wathu imeneyo, ndipo tu mwambo umeneyo uyambe ndi pemphero monga tinafotokozera, koma amene akongolera zonse zochitika ndi chimwemwe kujaliwa,
which is coming from Bishop Moffat Lichapa of the Zion Church. Thank you, Your Excellency.
Presided by His Excellency the State President, Dr. Lazarus Chakwera. Before we commence this signing ceremony, we commit our State President into thy hands. We ask you, Father, to bless him, to strengthen him, and stand with him. I bind all the evil spirits, the spirit of confusion and darkness, not to move around this room. Bless all the presenters. Start with us and end with us. In Jesus' name we pray. Amen.
Thank you very much for that opening prayer. That was Bishop Moffat Lichapa of the Zion Church. Your Excellency, Dr. Lazarus Chakwera, President of the Republic of Malawi, Honorable Simplest Yuchola Banda, MP, Minister of Finance and Economic Affairs, Honorable Halima Daudi, MP, Deputy Minister of Health, Ms. Colleen Zamba, Secretary to the President and Cabinet, Mr. Mark Alexander Edon Eddington, Head of Grant Management at the Global Fund, Professor Bichani Chereni, Secretary to Treasury and Chairperson of the Malawi Global Fund Country Coordinating Mechanism, Mr. James Manyatera, Secretary for Health Administration, Your Excellency, Ms. Ingrid Marie Mickelson, Ambassador of Norway to here in Malawi, and all members of the diplomatic corps, Dr. Chipo Kanjo, Board Chairperson of the National AIDS Commission, Dr. Luce Chapira, Board Chairperson of the World Vision Malawi, all senior government officials here present, members of the media, ladies and gentlemen, a very good morning to you. And let me welcome you all here at Kamozo Palace in Lilongwe for this very significant occasion that we have this morning, the launch of the Global Fund Grant Cycle 7, a vital initiative dedicated to combating HIV, TB, and malaria, while also strengthening our healthy systems and sustainability. This launch, Your Excellency, marks a crucial step forward in our collective efforts to overcome these devastating diseases and build a healthier and more resilient Malawi. Today, we will witness the signing of the grant officially. And here we are talking of over 525 million US dollars for the period of 1st July 2024 to 30th June 2027. Your Excellency, this is huge. This morning, we'll begin our program with goodwill messages. Your Excellency, the goodwill messages are coming from the donors who feed or who give into the basket. Now, today we only have 4. We have America, Japan, Britain, and of course Norway. But we also have Germany and other countries. These countries are not here with us, but we still recognize them. Now, to begin with the program, with the goodwill messages, it's coming from Miss Amy Diaz. She is the American Charge d'Affaires. A big hand, ladies and gentlemen.
Thank you. Your Excellency, President of the Republic of Malawi, Dr. Lazarus McCarthy Chakwera, Minister of Finance and Economic Affairs, Honorable Simplex Banda, Deputy Minister of Health, Honorable Halima Dowdy, our Secretary to the President and Cabinet, Ms. Colleen Zamba, and of course, all other senior government present. I'd like to acknowledge the Head of Grant Management of the Global Fund, Mr. Mark Eddington, Mr. Ocean Jones, Senior Portfolio Manager for the Global Fund, Heads of Missions and Cooperations present today, Secretary to the Treasury and Chairperson of the Malawi Global Fund Country Coordinating Mechanism, Professor Bachani Chireni, National Director for World Vision Malawi, Mr. Francis Dube, civil society representatives, members of the press, distinguished ladies and gentlemen, and with all protocols observed. Moni nonse. I think we need to do that again. Moni nonse. This is a happy day, and it is my deep honor to be present here with all of you for the launch of the Global Fund Grant Cycle 7 in Malawi. The United States is very proud to have been one of the founding donors to the Global Fund. When we made our first commitment to the Global Fund in 2002, Malawians had no access to HIV treatment in the public sector. Today, nearly 1 million Malawians are on life-saving antiviral treatment, and more importantly, Malawi's life expectancy has increased from 50 years in 2006 to almost 63 years today. I think that deserves a round of applause. This has been an incredible partnership with the government of Malawi over the past 20 years through contributions to the Global Fund, the President's Emergency Plan for AIDS Relief, otherwise known as PEPFAR, and partnerships with other donors present and not present at the table. Life for people living with HIV, TB, and malaria have now become filled with hope and productivity. The United States remains the largest donor to the Global Fund worldwide. During the 7th replenishment, the United States commitment of $6 billion accounts for nearly 40% of the 15.7 million pledged by donors worldwide. To complement the Global Fund, the U.S. government also provides life-saving bilateral support to Malawi through PEPFAR. This year, I'm pleased to report that roughly $176 million from PEPFAR funds, $24 million from the U.S. President's Malaria Initiative, or otherwise known as PMI, and $5 million from USAID's TB program. I mention this because it is imperative that we continue to work together, all of the Grant Cycle 7 principal recipients, so that we can maximize these funds during grant implementation to foster synergy, prevent duplication of activities, and promote joint program monitoring to serve all Malawians. My team has shared many stories from Oversight Committee site visits with me, where we see firsthand how adolescent girls and young boys gain life skills through trainings and support in Machinga, how we are bringing services closer to communities in Zamba and other districts to limit the distance that Malawians have to travel to healthcare facilities, and how global funded supported technical assistance strengthens procurement systems for health commodities. Why my fellow Americans back home may not often hear these stories and get the opportunity to meet Malawians here, I know they share with every Malawian the desire to live long, full, and healthy lives. And more importantly, the expectation that all countries will work jointly to secure this aspiration for all people. The United States is committed to continue working with the Global Fund and other partners to sustain the remarkable yet fragile gains we have made, and to accelerate progress towards ending HIV/AIDS by 2030. This is well within our grasp. Malaria by 2030. This is also within our grasp. And the TB epidemic by 2035. However, as we acknowledge the extraordinary partnership with the government of Malawi and our wonderful successes in terms of combating HIV/AIDS, we must also acknowledge new public health and climate-related challenges that Malawi has experienced and that will infect public health in the years to come. The U.S. government will look to the government to continue to take ownership of the national response to these three diseases and to increase domestic financial resources for the broader health sector, particularly in the face of limited resources and the need for donors now to meet new and emerging global health threats. Mr. President, I'm very excited to share that Malawi has been chosen to host the 52nd Global Fund Board meeting this November. This is a testament to your team. It is also a unique opportunity to showcase the impact of Malawi's partnership with the Global Fund. The U.S. government team and I look forward to continuing to engage with all partners, doing what we know works from the best available data, and doing so with a laser focus on direct service to the Malawian people, including but not limited to HIV, TB, and malaria, and building resilient health systems across Malawi. Zikomo kwambiri.
Thank you very much. We can do better on that. Thank you so much. That was the American Chargé d'Affaires, Miss Amy Diaz. Continuing with the program, another message, goodwill message, is coming from the Japanese Chargé d'Affaires, Mr. Seiji Tashiro. Thank you very much.
Thank you very much. Your Excellency, Dr. Lazarus Chakwera, President of the Republic of Malawi, Honorable Simplex Chichora Banda, Minister of Finance, Honorable Haris Daudi, Deputy Minister of Health, Ms. Corinne Zamba, Secretary President of the Cabinet, Mr. Mark Denton, Division Head of Grant Management, the Global Fund, and all Cabinet Ministers present, fellow member of Diplomatic Corps, member of the press, ladies and gentlemen, good morning. I'm greatly honored to have Your Excellency on this auspicious occasion as Malawi is launching the Global Fund Grant Cycle 7. I sincerely commend the government of Malawi for successfully obtaining funding from Global Fund for the joint HIV, TB, and malaria project. Your Excellency, the Global Fund plays an important role in defeating HIV, TB, and malaria in more than 100 of hardest hit countries. Since the establishment of the Global Fund in 2002, this worldwide partnership has made remarkable progress. On the present note, more than 59 million lives have been saved from these 3 diseases in the countries supported. I acknowledge effort the government of Malawi is making in addressing these diseases. To complement your effort, the government of Japan pledged to the Global Fund to contribute up to $1.08 billion over the period of Grant Cycle 7. Additionally, the upcoming 52nd board meeting of the Global Fund will be held here in Malawi in November. Japan has served as a board member of the Global Fund since its establishment, and it has contributed significantly to embodying the partnership approach to global health. Our board member, Deputy General, Dr. Imanishi, will also coming from Tokyo to Malawi in November, and he is very much looking forward to contributing to the discussion at the board meeting. Your Excellency, strengthening the health system is also set as a goal by the Global Fund, adding to the traditional countermeasures against HIV, TB, and malaria. The Tokyo International Conference on African Development, TICAD, ministerial meeting has just ended, and the joint communique also shows that the importance of strengthening health systems to achieve universal health coverage. Ensuring human dignity and human security, let's bring together all our joint efforts to take significant steps towards building a society where no one's health will be left behind. Zikomo kwambiri.
Zikomo kwambiri, Mr. Sage Tashira, Ambassador, that's the Japanese Charge d'Affaires. Thank you so much, emphasizing on the need to put much effort to continue helping countries out there, including Malawi, on issues to do with health for a more healthier and resilient country. Thank you so much. Your Excellency, another goodwill message is coming from the British High Commissioner, who is Miss Olympia Wereko Brobe. A big hand, ladies and gentlemen.
Thank you. Your Excellency, the President of the Republic of Malawi, Dr. Lazarus Chakwera, the Minister of Finance, Honourable Simplex Chitola Banda, Honourable Deputy Minister of Health, Ms. Halima Daud, Ms. Colleen Zamba, Secretary to the President and Cabinet, the Global Fund Division Head, Grant Management, Mr. Mark Eddington, all ambassadors and diplomatic missions present, development partners, principal recipients, distinguished guests, ladies and gentlemen. I am honoured to witness the launch of the ceremony for the Global Fund Grant Cycle 7. Today is a special moment for Malawi because this grant will go a long way in saving lives and reducing deaths from HIV, TB and malaria. Let me start by recognising the government of Malawi's leadership in driving the national response to these 3 deadly diseases and creating a strong enabling environment for sustainable partnerships. Without this strong leadership, these kind of global health initiatives cannot succeed. Secondly, as we sign the grant today, it's worth reflecting on the performance of the current grant under implementation. Impressive results have been delivered, including almost 1 million people here in Malawi being able to access the drugs they need when they're suffering from HIV or AIDS. The Global Fund is also playing a crucial role in wider health system delivery. This has been evident over the last few years with the event of the pandemic, cholera, and the tragic cyclones that have hit this country. Now is the right time to learn from this very difficult period in recent history so it can inform the next grant cycle. This will include finding new ways to improve integration and sustainability. The UK is proud of our role as the third largest historical partner to this fund, with investments of over 4.55 billion to date. I believe these contributions are central to delivering, alongside many partners in this room, international development and global health priorities in the areas of ending preventable deaths, increasing universal health coverage, and strengthening global health systems to cope with increased challenges. I would like to close by thanking everyone in this room as we work in collaboration to deliver for the people of Malawi. Zikomo.
Zikomo kwambiri, the British High Commissioner, Miss Olympia Wereko Brobe. Thank you so much. And lastly, we are having another goodwill message that is coming from Miss Ingrid Marie Mickelson, who is the Norwegian ambassador to Malawi. Thank you so much.
Thank you so much. Your Excellency, the President of the Republic of Malawi, Dr. Lazarus Chakwera, Honorable Minister of Finance and Economic Affairs, Simplex Chetiola Banda, MP, Division Head for Grant Management of Global Fund, Mr. Mark Eldon Eddington, Honorable Deputy Minister of Health, Ms. Halima Daoud, the SPC, the ST, the Chief of Staff, and the PS for Health on Admin, Directors, colleagues, all protocols observed. Muli bwanji nonse. Zikomo. Your Excellency, I'm delighted to be back in the country after some weeks in Norway, and what a great day to start the season. It is an honor to join you today as we celebrate the launch of the Global Fund Grant Cycle 7 here in Malawi. This occasion marks a significant step forward in our shared mission to combat the devastating impacts of HIV, tuberculosis and malaria, and to build resilient health systems that can withstand future challenges. On behalf of the Government of Norway, I extend my deepest appreciation to the Government of Malawi, the Global Fund, and all our partners for their unwavering efforts in this fight, as well as collaborating on pandemic preparedness and response. Global health is a key priority for Norway. We firmly believe that access to health care is not a privilege, but it is a fundamental human right. We also believe that the right to health care can only be achieved through a universal health coverage. This is why Norway has been a key supporter of the Global Fund since its inception, and this is why we pledged $190 million for the Global Fund's 7th replenishment, covering 2023 to 2027. Through our substantive and continuous support to the Global Fund, we aim to ensure that countries and communities in need have the necessary resources to save lives and build resilient health systems. This is also what the Lusaka agenda adopted at the Conference on Public Health in Africa last November. It is about strengthening health systems with a focus on integrated primary health care, increased domestic resources mobilization, and more aligned external support from development partners such as us. We would like to acknowledge the Global Fund's and international partners' commitment in this regard. Your Excellency, it is against this backdrop that I sit before you today with a great sense of honor and in deep appreciation. Malawi's progress in the fight against HIV, tuberculosis and malaria is highly commendable. The government's commitment to strengthening the health system, combined with the efforts of dedicated health workers and the support of local and international partners, has saved countless lives. The active engagement of the Ministry of Health at the global and regional level to help shape the Lusaka agenda is also highly appreciated. Norway is grateful for being a part of this global partnership and proud to be part of a success. However, despite our successes, we cannot be complacent. Challenges remain. There is a need to confront obstacles posed by laws, policies and practices limiting people's access to health services, and there is a need to ensure that knowledge and skills to understand and secure health-related human rights services are provided to communities that are affected by HIV, TB and malaria. And I would like to emphasize the importance of providing information and knowledge about sexual, reproductive health and rights also here in Malawi. We need to ensure that global health initiatives like the Global Fund and other global health actors are more efficient and equitable in complementing domestic financing in order to strengthen health system capacities and deliver health impacts as part of a country-led priority-setting process and trajectories towards universal health coverage. So please, Your Excellency, allow me to emphasize the importance of the new grants that are being launched today. They represent not only a continuation of financial support, but a deepening of our partnership. With these funds, I am confident that the government of Malawi will continue to accelerate its fight against HIV, TB and malaria, while also strengthening its health system to better respond to future challenges and to provide a lasting and positive impact on the health and well-being of the people of Malawi. Your Excellency, Norway remains a dedicated partner and we will continue to stand by Malawi and the Global Fund in our common mission to end these epidemics and strengthen health systems for everyone. I would like to congratulate the government of Malawi and the Global Fund and all partners involved for reaching this milestone. Zikomo kwambili.
Zikomo kwambili. That was Ambassador of Norway, Miss Ingrid Marie Megerson. Thank you so much. Emphasizing more on the need to be together, the collaborations, the partnership that is there. This is really huge. Now, we say thank you so much for these goodwill messages. And we're not only saying thank you to the four here, but even those who are not here with us. I think a big hand will do. We say thank you so much. We are so happy to have you and we are so proud to have you. Thank you so much. Your Excellency, we are continuing with the program. What we have now is the moment that we have all been waiting for, the official grant signing ceremony. So what is going to happen, Your Excellency, is that I'll be calling up names. These names are the ones that are taking part on this signing ceremony part, and the protocol team will be guiding up there. To begin with, let me call Professor Bechani Cheleni. May you please take the stage up there? That's the government of Malawi, public sector, on the Global Fund. We also have Mr. James Manyatera. Mr. James Manyatera is the Principal Secretary for Administration in the Ministry of Health. May you please go up there? Let me also call Ms. Charity Nkona, who is the Civil Society representative. And lastly, on this part, we have Mr. Mark Ennington, Division Head, Grant Management. the Global Fund. We are to witness the signing ceremony for the government part now. The signing ceremony, and it will be followed by exchange of documents between Professor Bechan and Mr. Mark Eddington.
Mwambo umene ukuchitika kuno ku Kamuzu Palace mu mzinda wa Lilongwe ukupitirira ndithu mwambo wokhazikitsa komanso kusayinira ndalama za nkhaninkhani zoti zigwire ntchito polimbana ndi matenda a HIV komanso chifuwa chachikulu cha TB ndi matenda a malungo. Ndipo akazembe oyimira maiko a America, Japan, Britain komanso Norway anayankhula ndithu kupereka mafuno abwino ku dziko la Malawi chifukwa chokhala ndi mwayi umenewu kuti ugwiritse ntchito ndalama zimenezi pofuna kukweza ntchito za umoyo maka polimbana ndi matenda atatu amenewa. Ndiye chomwe chikuchitika pakali pano ndichoti tsopano ndi nthawi yosayinira mgwirizano umenewu wa ndalama zimenezi pakati pa bungwe la Global Fund ndi boma la Malawi. Ndipo amene akusayinira m'malo mwa boma la Malawi ndi Secretary to the Treasury amene wandi Pechani Chereni, komanso pali mlembi ku nduna wa zaumoyo James Manyetera kusayina m'malo mwa boma la Malawi, komanso pali Mai Charity Mkona iwowa kuyimira mabungwe omwe siaboma dziko muno nawonso akusayinira. Ndipo amene akusayinira m'malo mwa bungwe la Global Fund ndi Mark Eddington omwe ndi mkulu woona za mathandizo amene amapita ku maiko osiyanasiyana ku bungwe limeneli la Global Fund. Nditu mene kusayinira kumene kukuchitika anthu onse amene afika ku mwambo umenewu kuonerera ndithu mwa chidwi kwambiri nkhani yosangalatsa ku dziko la Malawi. M'manja mwake ndi mmenemo.
Officially it is done.
Sayinira ndithu ndipo tsopano hayi kuonetsa kuti mgwirizano umenewu watheka kugwirana chanza Bechani Chereni komanso Mark Eddington kuti zimenezi tsopano zatheka. Nde ilo linali gawo loyamba losayinira, kenaka pabwerenso gawo la chiwiri.
The second part is that I'm calling for the principal recipient for the community. Yeah? Is being represented by the World Vision Malawi. Let me call Mr. Francis Dube, who is the National Director of World Vision, to please join the rest. Let the official signing begin.
Ndiye amene akusayinira mgwirizano umenewu kachiwiri ndi omwe aja amene analipo poyamba panali Bechani Chereni ndi iwanso adakali pomwepo komanso pafika Francis Dube amene ndi mkulu wa bungwe la World Vision kuno ku Malawi, komanso pali ajamai Charity Mkona kuyimira mabungwe omwe si aboma, ngakhalenso Mark Eldon Eddington kuchokera ku bungwe la Global Fund, ndipo tu abungwe la World Vision ali mu mgwirizano umenewu kuyimira anthu amene makhala madera osiyanasiyana mu bungwe la World Vision. Ndi limodzi mwa mabungwe amene akugwira ntchito madera osiyanasiyana mdziko muno, makamaka madera akumidzi, kuthandiza pa ntchito zosiyanasiyana za chitukuko, ngati kuonetsetsa kuti anthu akumwa madzi abwino, akutetezeka ku matenda osiyanasiyana, amathandiziranso ku matenda a chifuwa chachikulu cha TB komanso HIV, ngakhalenso malungo. Choncho nawonso akugwiritsa nawo ntchito ndalama zimenezi pofuna kutukula miyoyo ya Malawi pa nkhani za umoyo. Choncho tsopano amaliza kusayinira mgwirizano umenewu ndipo programu ikupitirira.
Let's now have remarks that are coming from Mr. Mark Eddington, who is the head of Grant Management Unit, and thereafter I'll call Honorable Simplex Chichola Banda, who is the Minister of Finance and here in Malawi, who is also going to do the honors of inviting His Excellency the President to address us. But for now, let's have the head of the Grants Management Unit. Thank you so much, Your Excellency.
Your Excellency, the President, Honourable Minister of Finance, Honourable Deputy Minister of Health, representatives of the Government of Malawi, representatives of the Diplomatic Corps and international organizations, representatives of national and international civil society and the private sector, all protocols observed. As head of the Global Fund's Grant Management Division, I'm honored to be returning to Malawi. This is a country I first visited in 1989, so 35 years ago. Always great to be back, Your Excellency. Delighted to represent the organization at this official launch of a new 3-year grant cycle. This is now the 7th funding cycle in the Global Fund's partnership with the Republic of Malawi. So it's a partnership that stretches back 20 years. And the Global Fund during this time has committed over $2.8 billion to Malawi's fight against HIV, TB, and malaria, and to strengthening the national health system. Whilst we should not be complacent, this is a fight that the Republic of Malawi is winning. And we, as the Global Fund, are proud to have been standing by its side, along with many other partners, over these past 21 years. The Republic of Malawi continues to be at the forefront of the ongoing fight to eradicate HIV, TB, and malaria, and is a major contributor towards the attainment of the international goals for each of these diseases. In the recent past, the progress made by Malawi has been remarkable. This has often been in the face of some significant obstacles, with the solutions found requiring determination, ingenuity, and innovation. Excellency, when we spoke earlier, I said the progress had been great. I wasn't going to go into the details with you because I would do it now. Is that coming? That is coming back on. Okay. So let me just summarize some of the achievements in Malawi. In terms of HIV, between 2016 and 2022, we saw an increase from 76% to 94% of over 1 million people living with HIV who know their status. We saw an increase from 91 to 98% of people who know that they're living with HIV receiving ARV treatment, and from 91 to 93% of people who are on treatment to be virally suppressed, which basically confirms the attainment of both epidemic control and the UNAIDS targets. And during that same period, new HIV infections decreased by 72% from 58,000 to 16,000 a year, with HIV-related deaths decreasing by 67% from 41,000 to 12,000. And I can tell Your Excellency, even 20 years ago visiting Malawi, seeing the coffin makers lined up along the roads, these kind of achievements would have been unthinkable then. So congratulations. For TB, by 2022, 71% of the estimated 81,000 people identified as having TBs were receiving treatment, with 90% of new and relapse cases successfully treated. Again, major achievements, still some way to go, but major achievements nonetheless. For malaria, between 2017 and 2022, the absolute number of deaths decreased by 49%, down to 1,800. And even though there were 4.2 million cases recorded in 2022, this is still a 41% reduction over the 7.1 million cases recorded in 2020. That is a massive decrease in the disease burden, particularly when you take into account population growth. And especially considering that malaria is the second leading cause of mortality in children under 5 years in Malawi. During the new grant cycle, Excellency, with your permission, we'd like to build on that, working with Malawi. Malawi will be the 7th largest portfolio globally for the Global Fund, an allocation of over $525 million. And with 405 million of that for HIV, that makes it the 4th highest allocation after Zimbabwe, South Africa, and Mozambique. And by the way, I would love to see those statistics for HIV in some of those other countries. The Global Fund's investments over the next 3 years will help ensure over 1 million Malawians, including key and vulnerable population groups, will continue to receive ARV medicines against HIV free of charge. We hope to get up to 75% of all TB cases being treated successfully without complications. And almost 12 million new generation insecticide treated nets will be distributed across all districts by the end of 2024. And that'll help ensure that every person in Malawi is able to protect themselves from malaria by sleeping under a bed net. All of these are critical at a time when the threats from other diseases and associated epidemics such as cholera and Mpox persist. And we discussed some of that earlier. Given the significance of the potential results that will be achieved, I really want to acknowledge all the organizations and stakeholders who are represented here today and who have in one way or another contributed to the development of these new grants. This effort has mobilized the government of Malawi, World Vision Malawi as the principal recipients of the grants, the Malawi Global Fund Country Coordination Mechanism, the National AIDS Commission, civil society and the private sector, as well, of course, the international community, including the governments of the US, Germany, UK, UN organizations, international NGOs and foundations. This is an excellent example of alignment and what can be achieved when all parties are committed and pulling together towards a common goal. The grants also include a provision of $50 million to support the strengthening of the national health system, and under the leadership of the Ministry of Health, the investments have been derived directly from the Health Sector Strategic Plan number 3, and build upon the US dollars, the $130 million in COVID-19 response mechanism funding already committed during the last period. So what will this funding do for health systems? They'll support the continuing strengthening of laboratory, oxygen, surveillance and community systems, human resources for health, supply chain and waste management facilities, and the construction of health posts and other facilities, including for enhanced case management, thereby helping to ensure the national health system is more accessible and better able to respond to the health needs of Malawians. Of course, the future sustainability of these investments relies to a large extent upon the government of the Republic of Malawi, ensuring the timely completion of the health system strengthening projects and fulfilling the counterpart and co-financing commitments it has made when finalizing the grants for a total of $232 million a year, and discussed that with the Honourable Minister for Finance as well earlier. And Excellency, we ask for your help in making sure that this materializes. For our part, the commitments the Global Fund have made under the new grants could not have been possible without the support of our donors, many of whom are represented here today. And we remain grateful for your continued commitment and trust in the Global Fund's mission at a time when there are many international challenges and competition for funding is really tough. I want to close by thanking you, Your Excellency, for having extended an invitation to the Global Fund for the Republic of Malawi to host our 52nd board meeting here in Lilongwe. We've accepted this kind of invitation. So all of our board constituencies will be meeting in Lilongwe between the 18th and 22nd of November. The board meeting will be yet another chapter in our partnership and will be an opportunity to demonstrate to the board and all of the people who will be here present the advances made in the fight against HIV, TB and malaria and in strengthening Malawi's health systems. We normally do organize a number of project and site visits, and I'm sure the board will be really interested to see the progress made, which, as I've said before, has been remarkable. So on behalf of the Global Fund's board leadership and senior management, I wish to thank you again for the invitation and confirm that we're all looking forward to coming to Malawi in November. Thank you. Sikomo Kwambiri.
Zikomo Kwambiri, that was head of the Grants Management Unit, Mr. Mark Edwin Eddington. Thank you so much once again. Your Excellency, before I invite Honorable Minister of Finance to make his remarks, allow me to recognize the presence of European Union representatives. They are here with us. Thank you so much, Your Excellency. At this juncture, let me now invite Honorable Minister of Finance to give his remarks, and thereafter he's also doing the honors of inviting you, Your Excellency, to address us. Thank you very much.
Thank you very much. Your Excellency, Dr. Lazarus Chakwera, the President of the Republic of Malawi, the Honorable Halima Daud, MP, Deputy Minister of Health, Mr. Mark Alexander Eddington, Head of Grant Management at the Global Fund, and the entire Global Fund team here present. The SPC, Mrs. Colleen Zamba, Dr. Bechan Cheleni, Secretary to Treasury, but also the Chairperson of the Malawi Global Fund Country Coordinating Mechanism, Mr. James Manyetera, Secretary for Health Administration, Her Excellency Ms. Ingrid Marie Mickelson, Norwegian Ambassador to Malawi, and all members of Diplomatic Corps, Mr. Pris Kapondangaga, Chief of Staff, State Residencies, and all members of staff here present, Dr. Chipo Kanjo, Board Chairperson of the National AIDS Commission, Dr. Lucy Kajapira, Board Chairperson of the World Vision, all senior government officials here present, members of the media, ladies and gentlemen. Your Excellency, today is a big day, a day for us to celebrate. So unique that, Your Excellency, to celebrate this big day, you have extended your invitation to host us at the State House. Therefore, I'm not intending to make a long speech because my duty this morning, Your Excellency, is to invite you to address us on a very auspicious occasion when you, Your Excellency, are launching the joint TB, HIV, and malaria grants under the Grant Cycle 7 with funding from the Global Fund, as alluded to by Mr. Eddington. Your Excellency, the Global Fund is our long-time strategic partner. For information, Your Excellency, for over 20 years, the fund has committed over $2.6 billion in support of the Malawi National HIV, TB, malaria response programs. Today, Your Excellency, we are yet witnessing another milestone when the Global Fund has approved grants amounting to over $525 million to contribute towards the national response to HIV/AIDS, TB, and malaria from 2024 to 2027 in this country. The increased resources from the Global Fund under the Global or the Grant Cycle 7 are highly valued. Your Excellency, this reflects the Global Fund's confidence in your government's ability to deliver quality services for the prevention and treatment of HIV/AIDS, tuberculosis, and malaria, and these resources will allow us to sustain the gains we have made in preventing new infections and also to sustain our achievements in the 95-95-95 goals. Your Excellency, your government is committed to fight against these three diseases, as demonstrated by government's increase in funding to HIV/AIDS within the health sector. Your Excellency, ladies and gentlemen, your government, through my ministry, is also committed to meeting its co-financing obligations under Grant Cycle 7, including the increased funding to health sector. And for your information, Your Excellency, in the current budget that we are running, 2024-25 fiscal year, your government allocated 12.5%, which is towards the 15% Abuja Declaration. And this, Your Excellency, made Malawi to be recognized in Kenya, but also invited to attend the Geneva functions this year. Your Excellency, the allocation in the national budget is an important demonstration that Malawi's government understands the importance of a robust and increased domestic financing for the national HIV, TB, and malaria responses, including building resilient and sustainable systems for health. The co-financing commitment, Your Excellency, has been agreed by the Global Fund, considers our country's overall microeconomic and physical situation, and are based on a careful assessment of the level of domestic resource mobilization to enable sustainability, while also considering other health, social, and economic priorities of the country. Your Excellency, Malawi further commits to realizing additional total domestic financing requirements of $2,299,696 during the year 2024-2026 or 2027 allocation. The importance of this grant, Your Excellency. The grants which is being launched today will strengthen the Malawi government's effort to fight AIDS, TB, and malaria. Hence, these grants are very crucial to this government as the country aligns itself to the Sustainable Development Goals towards eliminating HIV, TB, and malaria. I am very confident, Your Excellency, of the strides being made by Ministry of Health and all key partners towards these 2030 goals, and I am therefore highly indebted to the Global Fund for this support. Your Excellency, in conclusion, allow me to acknowledge the continued support from both our development partners and the Global Fund towards the fight against HIV, TB, and malaria in Malawi. I would like also to commend the Global Fund for realizing that to control these diseases, we need a strong health workforce and systems such as the supply chain in place. I would like to take this opportunity, Your Excellency, to thank the Malawi Global Fund Coordinating Committee, which is headed by Professor Chele and the entire team for the tireless work that they put towards realizing the grant that we are witnessing today. Once again, Your Excellency, let me also take this opportunity to thank the Grants Management Division of the Global Fund, headed by Mr. Mark Eddington, the Senior Fund Portfolio Manager, Mr. Ozias Jones, and the entire country team for working with us to ensure that the funding requests were of high quality and got approved by the Global Fund Board. As Mr. Eddington said, it was a competition, but we are happy that we made it. Your Excellency, it is also very good to note that in November, Malawi will be hosting the Global Fund Board meeting here. This is no mean achievement. It signifies the confidence and trust our partners have in your leadership. In the spirit of one Malawi, one people and one nation, allow me, ladies and gentlemen, to invite His Excellency the State President of the Republic of Malawi, Dr. Lazarus Chakwera, to address the gathering. Your Excellency, this is your time.
Thank you.
Honorable Simplest Chichola MP, Minister of Finance, Economic Affairs, Honorable Halima Daud MP, Deputy Minister of Health, Ms. Colleen Zamba, Secretary to the President and Cabinet, Mr. Mark Alexander Eldon Eddington, Head of Grant Management at the Global Fund, and the entire Global Fund team here present. Dr. Bechan Chereni, Secretary to Treasury and Chairperson of the Malawi Global Fund Country Coordinating Mechanism, Her Excellency Ms. Ingrid Marie Mikkelson, Norwegian Ambassador to Malawi, and all members of the Diplomatic Corps, Mr. Prince Kabonagaga, Chief of Staff, State Residencies, and all members of staff here present, Dr. Chipo Kanjo, Board Chairperson of the National AIDS Commission, Ms. Charity Mkona, Civil Society Representative, Dr. Lucy Kajapira, Board Chairperson of the World Vision, Malawi. I might recognize the National Director, Mr. Francis Dube, all senior government officials here present, members of the media, ladies and gentlemen. It is with immense pride and a deep sense of responsibility that I am here before you today to officially launch the Global Fund Grant Cycle 7, GC7. This marks the beginning of a renewed commitment to fighting HIV, tuberculosis, and malaria diseases. These are diseases that have for so long plagued the people of Malawi and hindered our progress. The government of Malawi and the people thereof remain eternally grateful to all the Global Fund donors whose commitment to making the lives of Malawians healthier is unmatched. The Global Fund has been an invaluable partner to Malawi since 2003, supporting our nation's development agenda by contributing tirelessly to our healthcare system and in the fight against these three diseases, but also coming to our rescue when the COVID pandemic hit us. I was glancing over there. I was privileged years ago to be one of the first commissioners when the National AIDS Control Program morphed into the National AIDS Commission, and Dr. Biswick Mwale was at the head of the Good to see you. So I stand very proud today as we launch this grant, because when the Global Fund embarked on the seventh replenishment to lobby for the current cycle, I was appointed a champion. So this grant is a testament to the Global Fund's unwavering dedication to improving health outcomes, especially in high-impact countries like Malawi. This grant will not only consolidate the gains we have made over the years, it will also strengthen and accelerate our national response to HIV, tuberculosis, and malaria. As we embark on this new phase of our partnership with the Global Fund, it is crucial to acknowledge the significant strides we've made thus far. Through previous grants, we have expanded access to essential health services, increased the availability of life-saving medications, and improved our healthcare infrastructure. With these grants, we have procured ambulances and utility vehicles, procured gas plants and modern hospital equipment such as CT scans, and we have recruited thousands of healthcare workers. I'm therefore highly indebted to the Global Fund for this support. Even so, we acknowledge that there is still a lot of work to be done. Hence, this grant cycle 7 will enable us to build on these achievements, ensuring that our healthcare system is more resilient, efficient, and the services accessible to all Malawians. Our commitment to improving healthcare is unwavering. We will continue to invest in strengthening our health systems, continue to use innovative strategies, and strengthen the supply chain management systems to ensure that quality-assured medicines and commodities get to the last mile in a timely and efficient manner. We will also continue to promote community-based interventions, empowering individuals and communities, and strengthening the community systems holistically. We are fully aware that the path to achieving our health goals is not without challenges. However, we are resolute in our determination to overcome these obstacles and build a healthier, more prosperous future for all Malawians. Our government will continue to prioritize health as a key pillar of our national development agenda, recognizing that a healthy population is a foundation for sustainable development and economic growth. As we launch the Global Fund Grant Cycle 7, I call upon all stakeholders, government agencies, development partners, civil society organizations, and the private sector to join us in this critical endeavor. Let me echo the remarks by the Finance Minister in commending all stakeholders who participated in the development of the Global Fund funding requests and made this possible. The journey, which started January 2023 through national consultative and inclusive process, has culminated into successful grants, which brings us here today. So I congratulate you on this patriotism. However, let me remind you that the best way to acknowledge these funds is through prudence in utilization of the grants and demonstration that we're using the grants purposefully. I trust that you will do just that. Once again, let me thank the head of the Grants Management Division of the Global Fund, Mr. Mark Eldon Eddington, and the entire Global Fund team for working with us to ensure that Malawi accesses these grants. And may the Parliament of the Global Fund that meets in Malawi this year, they represent all the stakeholders, but we are grateful that they will be holding their board meeting in this country this year, and you are most welcome. So with these remarks, I now declare the Global Fund Cycle 7 for Malawi officially launched.
Thank you very much, Your Excellency, for that powerful speech there, with an assurance to say the funds are going to be used to its intended purpose. Thank you so much, Your Excellency. This also marks the end of the program that was set this morning for the launch of the Global Fund Grant Cycle 7, GC7. Thank you so much, Your Excellency, for having time to have this event this perfect. We thank you from our hearts to you. We say thank you. And to all of you, thank you so much once again for coming and for being such an amazing audience at this juncture, Your Excellency. Let me invite you to stand and lead us into our national anthem.
tamva nyimbo ya mtundu wathu imeneyo pamene mwambo waukulu umenewu umachitika kuno ku nyumba ya boma ku Kamuzu Palace mu mzinda wa Lilongwe, mwambo wosayinira komanso kukhazikitsa mgwirizano wa ndalama za nkhaninkhani zomwe zithandize dziko lino pa ntchito za umoyo, ndipo kwambiri kuthandiza polimbana ndi HIV, kachirombo komwe kamayambitsa matenda a AIDS, komanso matenda a chifuwa chachikulu cha TB, ngakhalenso matenda a malungo. Ndipo bungwe la Global Fund ndi lomwe lapereka thandizo la ndalama zimenezi, ndalama zochuluka kubasi. Ndipo bungwe limeneli lakhala likuthandiza dziko lino kwa kanthawi ndithu, moti pali ntchito zambiri zimene ngakhale pakali pano zili mkati zomwe zikulandira thandizo la ndalama kuchokera ku bungwe limeneli. Pali zipatala monga zimene akuzimanga, maboma osiyanasiyana akuzimanga madera akutali kwambiri, malo oputa kufika, koma ndi thandizo la bungwe limeneli kumeneko boma likumanga zipatala ndithu, ngati kwa Kachere mboma la Dedza, ngakhalenso mboma la Phalombe, ku Mzimba, maboma ambiri ndithu, ku Ntchisi akumanga ndithu zipatala zosiyanasiyana zimenezi, komanso kuthandiza zipangizo zogwiritsa ntchito poyeza matenda, komanso mzipatala ngati ngakhale ku skulu ya ukachenjede ya ku Hesi kumeneko anapereka ndithu makina, komanso ku chipatala cha Mzuzu kumeneko kuli makina a oxygen amakono atsopano, mwazina chabe mwa mathandizo amene bungwe limeneli likuthandiza dziko lino pa ntchito za umoyo. Ndi mmene mwambo umenewu wafika kumapeto. Ifenso kuulutsa kwathu tilekezere pamenepa, ndipo ndithokoza anzanga onse omwe tagwira ntchito limodzi m'malo mwa iwawa. Ine Raymond Katayika tsopano ndikubwezereninso ku nyumba zathu zolutsira mawu ku Chichiri komanso ku Kwacha mu mzinda wa Blantyre. Zikomo.